Hi, my name is Lydia Toth, and I'm the producer of the upcoming Healthcare and Payment and Revenue Integrity East event. Today, I'm joined by Dr. Michael Seavers, the Vice Chair of the Harrisburg University Faculty, Department Chair and Program Lead, and Assistant Professor of Healthcare Informatics at Harrisburg University, who'll be giving the talk discussing the benefits of prepay versus postpay. Hi, Michael.
Good morning, and thanks for having me.
So, my first question to you is, what would you consider to be one of the most important factors that health plans should keep in mind when evaluating prepay solutions versus postpay solutions?
Well, you have to ask yourself, how much time do you want to devote to post-pay versus prepay? And why do I say that? You can spend a lot of time looking at your first pass, your second pass, your third pass, doing a lot of labor and effort, and you need to deal with your vendors too at the same time. So how much do you want to continue that into the future versus spending time looking at your prepay, doing some automation on your prepay side of the fence to lessen the post-pay things and do the rejection of claims up front, so it's quicker, it's more efficient, and things like that. But you have to realize, though, not everything can be pushed to prepay. Otherwise, we wouldn't even be talking about post-pay, right? Medical records and things like that are needed because of post-pay, but you really have to look at the trade-off between the post-pay, labor, maintenance, all that to push automation to prepay. So that's what I think is one of the most important things you have to look at.
So, following on from that, why do you believe understanding and analyzing the benefits of both solutions is important for a health plan at the beginning of their payment integrity journey when they haven't got that department quite set up yet?
Understood. You first have to look at the culture of your institution or your organization. And why do I say that? Some organizations are apprehensive to really do provider abrasion, really push back on the providers because they've been kind of giving them leeway over time because you just don't want to have a bad relationship with your providers and your hospitals and things like that. So you have to look at your culture first. And then by doing that, you need a strategy to show how you're going to affect those providers and hospitals. So if you're looking at to tweak your prepay to do more rejections and things like that, you have to show them and communicate to your providers of a before and after situation of what you're going to reject. I know in past history, what we did when we were putting in a claims editing system, we looked at the top 20 providers that we would affect in the top 10 hospitals. And we had the provider relations folks go out and talk to them before anything even happened so that they understood ahead of time what was coming. And you really need to look at your provider contracts too, because that's really what's going to affect the jargon and the talk and the discussion with the providers and the hospitals. And then you also, whenever you implement a prepay strategy, you have to look at how far back in history are you going to reprocess these claims to get monies back. You don't want too much provider abrasion, but at the same time, you really want to get the ROI out of your prepay implementation. So my basic answer to you is look at your culture and how much you're going to communicate with your providers and hospitals, because that's what the bottom line is. You need that communication.
Yeah, I mean, that's really interesting. And I really find it fascinating how it plays into like so much into what your relationship with your providers are and what your contract is like and the whole, provider networking situation that we also try to address within the conference. So I really hope that these two topics can tie in together and really give a whole holistic view of the entire, topic and issue.
Yeah. And to add to that, I mean, let's face it, payers, it's an unusual industry because you want to keep your patient subscribers happy. You want to keep your employer groups happy, which is kind of your demand side of the equation, but you have to keep your supply side of the equation happy too. Some industries, you only have to keep one side, like your customers happy versus your suppliers. But in a payer situation, you have to keep both sides of the fence happy to keep it going.
Yeah, I mean, managing expectations and managing relationships is a massive part of being a payer, I feel. So kind of moving on from that, what aspect of the upcoming event are you most excited about as an, an event that does bring these two groups together and tries to sort of start a conversation how these issues can be addressed?
Well, I really want to talk to the folks that don't have paper integrity units to really address, the benefits and the challenges to doing post-pay and prepay, and where the ROI really is. The word and the implementation. Really want to talk about the implementation of, let's say, a prepay claims editing system, because I know when I dealt with it, I was the lead, the sponsor, or whatever you want to call it. We had a major debate on how do we implement? Do we just implement the providers first versus the hospitals? And what we realized is in today's day and age, there is so much with the hospitals having so many provider groups that instead of having so many questions, if we would just implement the provider side of the fence, uh, we would have so many questions versus what the hospitals were still getting. So we went with a big bang. And you also have to look at, do you do commercial first or Medicare, or do you also go big bang? I'm an old IT guy, and I hate big bang. I really do. I would rather do it in smaller chunks, because if you screw up a small chunk, it's better than screwing up the big chunk. You know what I mean? But we debated it, and we went big bang. And we had providers calling. We knew it was going to happen, for the first few months, asking questions, things like that. We bulked up the customer service. You have to know that ahead of time. But what to answer your question, I'm excited about talking about implementations of prepay and things like that. So you, hopefully, you see my excitement.
Yeah, no, 100%. And I feel like everyone should be excited to listen to it because I feel like you have a lot of information and a lot of strategies and a lot of data and knowledge to share with people. But if someone is on the fence about attending this event, what would you say to them about coming and taking part?
Okay. To be blatant, if you're looking to create a solid payment integrity unit, come to the conference. Payment integrity units are looked at kind of on a small scale at first, but to get the real ROI, you need good people that know the provider contracts. You need the people that know claims coding really well. And yes, you have to bring in the lawyer as well to know the federal guidelines and the state guidelines and things like that. I was just talking to some people with the CDC and those particular folks. Some of the new things that are coming down the line with regulations, you have to keep up with it. And just a 1 or 2 person team, I hate to say it, you're focused on claims, et cetera. You're not looking at the bigger picture into the future. You need people to look at that at the same time. Because let's face it, there's always a tug of war between the providers and the health insurance companies. The providers want to be paid the most possible. The payers want to pay the least possible. In a healthcare system, we have 3 major things. We have cost, quality, and access. And with what we're talking about from a payment integrity is really all about the cost. And what is the most equitable to really pay the providers the right amounts, but at the same time, don't pay them too much, especially when you look at bundling and things like that over time, duplicate claims, invisible providers, things like that.
I mean, that's really interesting. And I really hope a lot of people take your advice and come to learn more about all of this information because it is very, very, I think, very important. And today's day and age quite crucial for a health plan to
Hmm.
know about. Well, I feel like all I can say is thank you so much for sharing so much
Oh, sure.
information and taking the time to do the interview. I I'm very much looking forward to meeting you in Boston in person and hearing everything that you have to share about
Agreed.
all of this, payment integrity claims, everything else, and implementation. And I look forward to seeing you then.
Uh, Likewise. Thank you very much for having me.
Bye. Bye.